I'm Diety.
And I'm Emily, and today we're going to talk to you about innovative jobs in healthcare. First, let's start with some basics. We need new jobs to fix our broken healthcare system in order to improve our healthcare quality and delivery. We're still using our old healthcare system from the past with all of our new knowledge and technology, and it's just not working anymore. Now we need new jobs that will translate our knowledge into a win-win for both patients and the healthcare system, instead of stuffing all of our old knowledge and equipment through the old system like we are now. So today we're going to introduce you to some new and really innovative jobs that have potential to change healthcare in the future. Instead of investing ourselves into the regular mainstream health jobs of today, like hospital managers, for example, it would be much more beneficial for us to invest ourselves into evolving fields that have the potential to become booming for the health industry.
First, home-based care is going to be big. As they say, go to the hospital if you want to get sick. Old people don't want to be stuck in an ICU or nursing home getting infections they didn't come in with. So jobs that bring the hospital to your home are going to be needed. This means home monitoring and home use devices such as virtual monitoring technologies, telehealth systems, and text-to-speech technologies. Likewise, patient follow-up care and managing home patient follow-up care after they are discharged from the hospital are going to be big. Applications that guide and monitor patients through recovery while also identifying at-risk and highest expenditure patients will help provide patients with better care while reducing costs and resources. Reducing cost of care by spotting issues early. Jobs in medicine, research, design, and mobile development. Jobs that measure the actual cost of patient care from their first contact with a healthcare provider until their follow-up care. This includes identifying the quantity and unit cost of each research. For example, clinical staff, equipment, supplies, devices, and administrative support. Used during the patient's stay and adding this together to learn the total cost of patient care. For example, clinical staff, equipment, supplies, devices, and administrative support. Used during a patient's stay and adding this together to learn the total cost of patient's care. Next, IT systems are going to continue to grow and make our healthcare system more efficient. For example, creating and managing database systems that give patients information about the best place for them to go for treatment based on their needs, resources, insurance, and location. More old people means higher Alzheimer's rates, and therefore more jobs in Alzheimer's research and prevention, such as memory exercises, drug therapy, disease management, and patient quality of life. We need to better understand this disease before being successful in controlling, managing, and hopefully getting rid of it.
Soon we're going to start seeing customized pills. People are no longer going to be taking multiple medications multiple times a day and multiple doses, which are most likely wrong for them. There's going to be a lot of research going into finding the specific correct doses for every individual so people don't have to waste their time with the wrong medications or incorrect doses. This also is going to open up fields for health marketing jobs and management jobs and more research jobs. The customized pill industry is going to be a big one in the future. Jobs in research and development of artificial organs is going to be huge. We've already been doing artificial limbs like the joints and the knees for a while now, and it's going to be about 20 plus years before we probably get a cost-effective manufacturing process for artificial organs, but once we do, this is going to be a booming industry. Can you imagine how much this would help people with diabetes and chronic diseases? Artificial organs will be life-saving. The future is going to be a really exciting time for stem cell research. We've already had a lot of interest and gained a lot of knowledge in this area. For example, researchers now know how to use stem cells to make bone, brain, blood cells. But in the future, we're going to need jobs to unite all of the knowledge that we have with therapeutic interventions that we can use for new treatments. The Human Genome Project was published 10 years ago at a cost of $1 billion, but since then its cost has decreased dramatically, which will make DNA sequencing huge in the future. DNA sequencing is especially important because DNA is everywhere, and sequencing is very specific and rarely makes mistakes. In medical research, DNA sequencing can be used to detect the genes associated with many hereditary and acquired diseases. One example of how DNA sequencing can be routinely used in the future is in prenatal diagnostics. Today, most expectant mothers undergo the very accurate but also very costly and risky amniocentesis test to check for birth defects in their baby. In the future, it will be more cost-effective for pregnant moms to instead have a blood test that labs can then use to extract the DNA of the baby without the risks involved in amniocentesis. In the future, scientists are going to be successful in creating a broad-spectrum antiviral. This will be kind of like a penicillin-like drug that will target viruses more broadly. This means that there will be one antiviral that will be able to treat many types of viruses like Ebola, influenza, rabies, HIV. We need jobs in research, management, and public health in order to develop a broad-spectrum antiviral and make it accessible globally.
So as you can see, there's lots of new exciting opportunities for graduates interested in health.
So you all have no reason to be pessimistic about your future.
Let it rock, let it rock, let it rock. Now the son's disgraced. He who knew his father when he cursed, his name turned and chased the dollar. What it good if you don't dream big. What's the use in dreaming if you don't have faith? There's nothing worth believing. It takes one hope to make the stars worth reaching for. So reach out for something more. Let it rock, let it rock, let it rock. Now the son's disgraced. He who knew
Which will make human genome it's DNA.
let it rock, let it rock, let it rock.
More old people